Hello everyone, it's Dr. Sam. I'd like to welcome you to my EyeClarity Podcast. This is a show that offers cutting-edge information on how to improve your vision and overall wellness through holistic methods. I so appreciate you spending part of your day with me. If you have questions, you can send them to hello@drsambyrne.com. Now, to the latest EyeClarity episode. Hey everybody, it's Dr. Sam, and I want to welcome you to another EyeClarity Podcast. I'm going to take one question today. This is from Jesse. He's a longtime listener. He has developed a condition called Horner syndrome. This affects the pupils of the eye, can also affect the eyelids, and it can even affect the muscles in the face. It's quite difficult to diagnose, and you want to go to an ophthalmologist or a neuro-ophthalmologist who can test you to see what your pupil responses are. Now, the pupils are the gatekeeper that allow light into the eye. You know, the pupil gets smaller as we go out into bright light, and it will dilate as we dim the lights. And in Horner syndrome, there can be pain associated in our eyes. It also can affect the droopiness of the eyelids. We call this ptosis. Again, you want to rule out things like tumors, trauma, stress, inflammation. And the other thing that I take a look at is just our overall circulation to the eyes. So you can do an imaging test. Sometimes an MRI can show a tumor or a lesion, which can explain this underlying cause of the irregular pupil response. But from a more holistic, integrative medical perspective, here are some things that I suggest and recommend. Well, first of all, I think that getting some craniosacral therapy can be very helpful. You know, when you do the cranial work, what you're doing is you're creating spaciousness in the fascia and the connective tissue, especially if you're working on the head and around the eyes. And if you can develop a kind of a more expansive cranial rhythm, that's the cerebral spinal fluid pumping in and out of the brain, and it's going to affect the eye circulation. This is a technique that I feel is very helpful at reducing irritation in the nerves, inflammation, stress, trauma. So it's my number one go-to in terms of this particular condition. The second thing that I would consider would be some acupuncture. You know, acupuncture doesn't necessarily treat symptoms, but it opens up the meridians in the entire body. And we know that many of the energy meridians travel to and from the eyes, and they go to the glands and the organs in the entire body. And when you open up the meridian energy, this can sometimes help increase the function of the nerves, reduce pain, and it's a great modality in terms of creating more harmony and balance in the eyes, brain, and body. The third thing that I would suggest would be to use castor oil, especially in the evening. You can get some organic castor oil. I like to massage it into the face. Also, you can take a drop or two and massage it lightly into the eyelids. There's so many great benefits of castor oil. You know, it's an ancient Egyptian modality that's been used. In current times, castor oil has been shown to actually be wound healing, reduce inflammation, irritation in the skin. It's also highly moisturizing. It hydrates the tissue. And, you know, when you get into pain and inflammation, a lot of times there's a drying out of the tissue. And so the castor oil massage can be really excellent at replenishing and rejuvenating the skin in the face and around the eyes. Another technique that I find to be very helpful for this condition is color therapy, especially the blue end of the spectrum. So looking at the turquoise color, the blue color, 5 to 10 minutes a day. You can do this with colored gels or colored glasses, and you receive the color into your eyes. You do some breathing, you breathe it in, and you do this for 8 to 10 minutes every day. This can also be beneficial for improving the health in the nerves in the face and around the eyes. And then lastly, the exercise that I recommend is called the palm hum. That's the one where you rub your hands together for about 10 seconds. You place the palms over your eyes, you close your eyes, and you breathe in normally through your nose, and on the exhale, keep your mouth closed, and you make a pretty loud, low humming sound. So the hum is going to vibrate the face and in and around the eyes. Sound is one of the best ways to heal nerve issues, to get rid of pain and inflammation. Sound vibrates, it creates more circulation in the tissue, and it's a really effective strategy in getting rid of eye stress, improving eyesight, and with these kinds of neurological conditions, it can be really helpful. And then last but not least, I would look for a naturopath or a functional medicine doctor, and I would explore dietary changes, increase probiotics, the microbiome in the gut, eat an anti-inflammatory diet, find out if there's any systemic inflammation, especially in the gut area, if you're suffering things like candida or irritable bowel syndrome or exposure to things like heavy metal toxicity or mold. All of these things can actually affect your eyes quite profoundly. And if you improve your liver health, you can actually improve your eyesight and vision. So, Jesse, I want to thank you for the question. So, ladies and gentlemen, that's a wrap, and I want to thank you for joining me today. Until next time, take good care. Thank you for listening. I hope you learned something from the EyeClarity Podcast show today. If you enjoyed the episode, make sure to subscribe on iTunes or Spotify and leave a review. See you here next time.